If you've had a doctor's appointment in the last year, there's a good chance it happened over the phone or through a video conference because of this crisis. Vermont lawmakers are now considering whether telehealth appointments are worth keeping around even after everyone is vaccinated. State House reporter Devin Bates has more.
On Wednesday, state reps heard from healthcare workers and advocates on the benefits and drawbacks of over-the-phone appointments. There's an obvious convenience factor, but some say Vermont's spotty cell phone service and limited broadband access prevent telehealth from being what it could be.
I have a mom who would go to um, the library, right in front of the library, to get internet because she can get internet.
Last year, the Vermont statewide telehealth work group was created to develop long-term recommendations, chief among them being the need to address that digital health divide. Even so, there's some patients that have other limitations. Mayumi Cornell is a patient representative who had spent the last few weeks caring for an elderly man in her neighborhood. He passed away on Sunday.
He had a really hard time, because he's older. He has a phone and he had phone service, but he could not read the screen because it's too small, and he doesn't have a computer.
Michael Fisher, a chief healthcare advocate for Vermont Legal Aid, said there's been a lot of sticker shock after patients hang up the phone, and if telehealth is going to be a part of the state's future, there needs to be more emphasis on ensuring the quality of remote healthcare matches its cost.
Training is super important here. I've heard it mentioned that there are good provider trainings going on. I also want you to know that I've heard that many of those trainings have been focused on the billing aspects, not the quality aspects.
Last month, Governor Phil Scott proposed a $20 million package to get broadband to more homes and businesses in Vermont. Now, the work group is also proposing that lawmakers take steps to make telehealth more accessible for those with disabilities. Devin Bates, Local 22 News.